Everyone for coming to this presentation. My name is Mead. I'm a manager at NineSquared. We're an economic and strategy consulting firm with offices in Sydney and Brisbane. Today I'm going to be sharing with you my work on developing a cost-benefit framework for evaluating investments in improved drinking water quality with an Australian perspective. So the goal of this work has been to develop a structured CBA framework for evaluating these types of investments aimed at improving drinking water quality in an Australian context. The motivation for this has been twofold. The first being that existing frameworks don't explicitly identify which costs and benefits are relevant, nor how to monetize many of these. The second being that many rural, remote, and particularly Indigenous communities lack access to water that meets minimum drinking water quality standards. So that's a nice link between the first presentation and this one. A study from 2024 found that there were over 115 locations in Australia that failed to meet the Australian Drinking Water Guideline health-based values at least once in 2018 and 19. We can see from these dots there that a lot of these are in central regions where they're either remote communities or Indigenous communities. New South Wales is greyed out simply because there wasn't location-specific data. So this equated to almost 200,000 people who access water that failed to meet the guidelines. And 40% of these locations that failed to meet guidelines were remote Indigenous communities. So the approach to developing the framework can be summarized in 4 steps. The first was to review existing guidelines, focusing on the applicability of these guidelines to assess improved drinking water quality. So looking at what are the costs and benefits that have been explored previously and which of these should we adopt. The second was to look at the academic literature, focusing on whether or not there was a link between certain factors and improved drinking water quality with respect to health, social, and economic implications. So an obvious one there being cost of illness from waterborne disease, for example, and trying to capture those. There we looked at compiling a list of impacts to be considered. And then we sought to identify suitable valuation methods with consideration of availability of data, robustness of those methods, and the practical feasibility of applying them, in particular in relation to data poor and small population settings that, by and large, are the communities that are facing poor water quality. So, as for the framework itself, this is just a really simple high-level diagram which essentially tells you that this isn't trying to reinvent the wheel. The framework identifies the costs and benefits that would be relevant to these types of investments, looks at how we should aim to monetize these costs and benefits, and then from there applies standard CBA process. So things like defining a base case, project options, discounting, and developing MPVs and BCRs. That's all standard. And this is really just a way of ensuring that we are thinking about the right things when we are evaluating these types of projects. So looking at the costs that we should be capturing, the relevant costs will differ depending on the type of project being evaluated. So broadly, that can be disaggregated into infrastructure and service-based projects. And of course, many projects and scopes of works are going to include both of these types of projects. So infrastructure projects, for example, we're looking at things like upgrades to water treatment plants or construction of replacement of pipes and pumps, upgrades to water storage, desalination units potentially, and introducing catchment fencing or buffer zones, with the associated cost categories being CapEx, so including things like construction, design and planning costs, cost of procurement and installation, cost of maintenance, and then in some cases decommissioning expenses. Service-based projects, on the other hand, could be things like drinking water management plan development or updates, providing additional resourcing where required, providing staffing, providing training to existing staff, and potentially investing in or improving emergency response protocols. With the relevant cost categories here being things like staff costs or consulting fees, cost of training, and the provision of ongoing technical support. Now, for any given project, there might be aspects that lie outside of trying to improve drinking water quality. For example, a lot of projects now focus on water in all forms, so looking also at things like not just drinking water quality, but quality of other water, so quality for recreation or wastewater or irrigation. And so other cost categories might be involved if the project involves these other types of works as well. So looking at benefits, we've separated it into three broad categories. The first being improved efficiency and financial impacts. So looking at the avoided cost of alternative sources of drinking water, avoided capital and operating costs, and reduced administrative burden, particularly for things like issuing boil water advisories or do not consume alerts, which, depending on the size of the task at hand and the days with these alerts in place, could be material or might not be material in relation to the other benefits of the program. Community benefits include things like reduced time spent boiling or collecting water, avoided cost of illness from waterborne diseases, and avoided cost of illness from increased sugar-sweetened beverage consumption. And other impacts include things like reduced greenhouse gas emissions, improved equity, and residual value. Reduced greenhouse gas emissions has an asterisk there because, unlike other benefits, it's quite likely that a with project scenario is going to result in greater greenhouse gas emissions than without and comprise a disbenefit. So, for example, if we're constructing a new water treatment plant, the embodied carbon involved in the construction and cement and concrete and transporting of materials to and from is likely to be greater than a base case, which is a business as usual scenario. So looking at valuation techniques, so through this framework, we've tried to provide suggested approaches to monetization. And this is really just a hierarchy in terms of what's preferred. So looking first at market-based approaches if possible, which utilize observable market prices as a basis for estimating benefits, which is what's effective where direct costs or savings can be identified but not effective elsewhere. Then non-market valuation techniques, so things like stated and revealed preference surveys or alternative pricing methods, which can be used to assess benefits that don't have market prices. And then benefit or unit value transfer, so applying existing estimates from comparable studies to similar contexts, facilitating easier implementation when primary valuation is resource intensive or not possible. And then qualitative assessment. So when monetization is impractical, using qualitative assessment ensures that we can evaluate benefits based on expert opinions and stakeholder insights, and making sure that we're capturing everything, even if we can't put a dollar value on it. So looking at some of the benefits, I'm just going to go through a few of these due to time, and so we have time for questions at the end. So improved efficiency and financial impacts, what I'm going to look at is the avoided cost of alternative sources of drinking water. So improved drinking water quality reduces the need for households, businesses, and/or the government or water utilities to purchase bottled water or rely on other costly alternatives during water advisories. So this could involve bottled water, things like water carting, or the additional purchase of refillable water containers when water is not safe to drink. So the approach here is to estimate the cost of this alternative water source, including distribution. So, for example, if households and businesses are purchasing bottled water, we could try to estimate these costs by conducting business or household surveys, while things like water carting or measures such as the water utility itself or local council providing bottled water, engaging with those stakeholders and determining what amount of money they've spent on these alternative sources of water. Looking at community benefits, the approach to the avoided cost of illness is at a high level more or less the same, whether that's from sugar-sweetened beverage consumption or illness from waterborne diseases, with waterborne diseases being a bit more straightforward. But I'm going to focus on the avoided cost of illness from sugar-sweetened beverage consumption. So these types of beverages include cordials, juices, energy drinks, and soft drinks, essentially anything with added sugar. And this is one that was revealed through the literature, which found that access to quality drinking water reduces substitution with these types of beverages, reducing rates of diet-related illnesses such as diabetes, obesity, dental caries, and cardiovascular disease. And the approach here to monetize it is to estimate the reduction in these diet-related illnesses due to improved water quality, and applying the associated cost per case, including direct and indirect health costs. So those direct and indirect health costs would include things like reduced quality of life, productivity losses, potentially reduced life expectancy. This cost per case could be determined via a bottom-up approach or via benefits transfer if a suitable similar study is available. So this is one where, for all intents and purposes, it's likely that qualitative assessment is all you're going to be able to do, particularly in data-poor environments and small communities. Without further research being conducted, it's very hard to determine what the actual reduction in these types of illnesses will be, particularly in contexts where there's been poor drinking water quality. People are drinking these beverages more often. There's very little research on, well, if we now improve the drinking water quality, what does that do to consumption? And from that, what does that do to illness? Despite that, the research shows that in areas with poor drinking water quality, rates of consumption is higher. And so it's important to still capture that there's an expectation if water quality is improved, rates of these illnesses would be reduced. So there's an opportunity there for much more research to try to enable accurate monetization of these benefits in the future. Other impacts. So an interesting one here, I thought, was improved equity. So the theory here being that enhancing drinking water quality addresses service disparities affecting remote and disadvantaged communities, particularly those with high First Nations populations. Now, the suggested approach to monetization is simply just to qualitatively assess it. but support this by evidence of public value placed on improved equity in this context. So a survey actually found that Australians are willing to pay between $324 and $847 per year for 10 years to ensure good drinking water for all. So equity is normally something that doesn't come out in CBA and is a criticism of it, that it doesn't do that outside of potentially distributional analysis. But in this context, given that essentially a willingness to pay has been placed on that value of improved equity, I do think it is something that should be captured, although this survey outcome is a willingness to pay to improve good drinking water for all. So if we're improving drinking water quality for, say, one community, it's difficult to place a value on that. But there is a value attributed to improving equity of drinking water availability in general. So looking at results of the CBA, the standard NPV, net present value, and BCR benefit cost ratio, where benefits outweigh costs when NPV is greater than 0 or BCR is greater than 1. As I'm sure we're all familiar. But the key caveat here and thing to note is that the framework isn't intended to justify inaction when those results aren't met. So good drinking water quality is defined by the United Nations as a fundamental human right. So it's definitely not intended to justify inaction when the monetized benefits don't outweigh the cost, but rather the purpose is to prioritize, compare, and understand. So if there are multiple locations that we're considering providing funding to address their water quality issues, and that budget is constrained, this framework provides an opportunity to select which ones to do first or rank them based on the outcomes of the study. It enables us to compare similar or competing options for that might address similar or the same issues, and really just understand what the costs and benefits actually are. And so a good way to kind of see how this framework can be applied is through a case study. So this is a real case study that we completed for a state government department in Queensland. Some details have been changed for confidentiality reasons and also illustrative purposes, but this is a real example. So for some background, regional Queensland community faced persistent water quality issues. So they experienced ongoing and frequent boil water advisories for a majority of the year. We applied this framework over 30 years of operations to evaluate the costs and benefits of a program of works to improve that water quality. So that evaluation period was from 2025 to 2066. So in the base case, the assumption is that there would be piecemeal funding. So they would get funding to improve water quality through various works eventually, but not upfront. So minor fixes in 2033 and major works 11 years later in 2044. So well into the evaluation period. Under this base case, it was assumed that the community would experience prolonged boil water advisories until 2046, so until those major works are completed, and as a result would experience negative health impacts, additional time spent boiling water, and avoidable infrastructure costs. In the project case, the project is that it would fund short and long-term works up front, so from the start of that evaluation period, and all of the required upgrades would be completed by 2027. And from that point onwards, boil water advisories would be eliminated. So as a result, we're avoiding negative health impacts. We're reducing the time spent boiling water from households, and we're avoiding infrastructure costs. So for the reduced time spent boiling water, the approach to monetization was um, multiply the number of days spent with boil water alerts by the average time spent boiling water per household per day, times the number of affected households multiplied by a value of time. So the number of days spent with boil water alerts was found to be 225, and we assumed that in the base case this would occur until further works are completed. Um, we developed this assumption based on the average number of days with boil water alerts over a historical 7-year period, considered representative of the base case. And we did this in discussion with the department and members of the local council. We assumed that the average time spent boiling water per household per day was 45 minutes. Now, this was based on a precedent, a study undertaken in a similar context, which estimated that when boil water alerts were in place, households would spend 1.5 hours per day. And we adjusted this down based on an anecdotal lack of adherence to advisories. So in speaking with members of that council, it was well understood that not many people, or certainly not a majority of the community, was actually following the advice of boiling their water, at least not 100% of the time. The number of affected households was provided by council, and as for the value of time we used, we decided to use a minimum hourly wage, which was a simplified conservative assumption. This again was taken from that same precedent study above. The difficulty here is that there's no one value of time for avoided time spent boiling water. So an alternative approach could be aligning it to potentially other guidelines, which might suggest a percentage of an average wage. But really the opportunity here would be to try to conduct a study, ideally in this local community, which can identify the value of time that these people are placing on that time that could be avoided. The avoided costs of illness from waterborne diseases, where we would try to monetize it using the impacted population times the proportion of year with boil water advisories multiplied by an annual cost of illness per person experiencing poor water quality. Again, the number of affected households came from the connected population provided by council. The proportion of a year with boil water advisories was found to be 62%. So that's just the 225 days with boil water alerts out of 365. And the annual cost of illness per person experiencing poor water quality was found to be $387. For this, we simply used a benefit transfer from a study estimating reduced illness cost based on a 30% fall in gastroenteritis cases when water quality in New South Wales country towns was improved to meet guideline standards. Now, we decided to use a benefit transfer approach for this, largely due to availability of data, was not something that we expected we could get our hands on, and also the amount of time and resources that we wanted to spend on this evaluation. But other options which are likely to be better include getting your hands on that data and determining what illnesses are related to poor water quality, potentially being able to determine if there's data back from when water quality was good, being able to compare that and potentially doing a differences approach to that. But as I said earlier, benefit transfer or unit value transfer is always good when conducting studies yourself isn't an option. And avoided infrastructure costs were based on average historical annual spend over a 7-year period, considered representative of the base case, and that was provided by council. So some insights from this case study. Based on those quantified benefits, the results showed a BCR of 1.3, demonstrating that the proposed program would deliver benefits exceeding costs. But through applying this framework to this context, we did encounter several limitations. So particularly a lack of data relating to what the occasions of illness due to poor water quality were. We did try to talk to the local hospital there, but they weren't able to provide us data, at least not in a timely manner. Time spent boiling water. Again, we had no opportunity to conduct a household survey, so we used that 45 minutes, but potentially that time spent boiling water could be less based on the anecdotal lack of adherence. As I mentioned, the willingness to pay to reduce that time spent boiling water is also something we couldn't look into, and avoidable household costs. So would people in the future be expected to change their behaviour should this poor water quality continue over even more years? Would people install filters or purchase other things that would change their behaviour? Is not something we were able to consider. As I said before, the sugar-sweetened beverage consumption is something that had to be assessed qualitatively, simply due to that absence of data and the extent to which consumption and related illnesses change in response to improved access to clean drinking water. But given all of these limitations, extensive sensitivity testing was conducted to test the robustness of outcomes with changes to key parameters. And that's something that is very important, particularly where we're not sure of the applicability of unit values that we're transferring from other studies, or if we don't have good access to data and we have to make assumptions, sensitivity testing becomes very important. So to conclude, the framework provides a structured template really for applying CBA in these types of projects. It incorporates non-market impacts such as health benefits and time savings, along with traditional impacts such as real cost savings. It aims to provide flexibility in valuation methods suitable for data poor contexts, and really it provides a foundation for future guidelines. So all of those guidelines, for example, that New South Wales Treasury puts together, which provides, specific parameter values. If you're evaluating this benefit, use this calculation and adopt this parameter value. This is kind of a precursor to being able to do something like that. And overall, the development of this and application of this framework aims to ensure that the full value of safe drinking water is recognised, and aims to contribute to advancing public health and social equity in communities which have historically been underserved. So that's it from me. Thank you. And any questions?
Thank you, Lee. I'll go straight to the question time.
That was an excellent presentation. It's really, I guess, topical given all the much about PFAS, etc., and just water quality. I guess my question, and sorry, my name's Alex, I'm from Frontier Economics. I guess my question is, one of the challenges around water quality is that it's not a guaranteed outcome. So obviously you're locking in the financial costs of addressing water quality to help reduce the risk of poor water quality going forward. So do you, I guess, have any commentary about overcoming that challenge and bringing in risk and uncertainty into the analysis?
I think again, that's probably obviously we're engaging in a project and the goal is to improve water quality, the hope is that it would do so, and that is something that can be, an assumption of the project case is that it fixes water quality. I would say if there's any doubt that that isn't the case, sensitivity testing could be an option. I'm saying if it doesn't completely fix water quality and it results in 50% less boil water advisories, what do the outcomes look like then? But I must admit it's not something that I thought of. I guess determining whether or not a project is going to I guess succeed or fail in terms of meeting its fundamental goals is not something that I've really considered. I guess the assumption is that if a project is going to do what it says it does, this framework kind of is contingent on it actually doing that. And I think that's probably similar for majority of the CBAs that we do. That's kind of an inherent assumption. So interesting thought, but not something that this explicitly considers.
I'm just wondering, probably shouldn't say this in a CBA forum, but maybe it's a question, given what you said about it being a World Health Organization, right? That maybe it's just a cost effectiveness. We don't need to worry about the boiling water time and all that. We have a goal to deliver drinking water that meets the drinking water guidelines, and what's the best way of doing it, and not worry about all the other.
Yeah, that's definitely something to consider. I do agree that given that it's a fundamental human right, really I don't even think a framework is needed. Really, we should just be trying to fund these projects so that everyone can have access to quality drinking water. So I completely agree in that respect. In the other vein, a lot of, for example, grant applications and government funding requires a CBA. So this has been developed with those requirements in mind. And if a CBA is needed, well then we should be trying to do our best with that. But I do agree with your point that we should just be trying to do what we can to provide drinking water to these communities, regardless of the specifics of what the benefits are. So I agree.
Yeah, just to add to that, I think I agree with your slide about how the benefit and cost ratio, even if it's below 1, even if the net present values is below 0, that we still need to invest in these projects. And I think that's because it is the basic human right. But also from a CBA perspective, we could think that is just the way that we're not measuring the indirect and the indirect benefits and costs correctly, and that's the reason why the values are coming up. In that way.
That's the other aspect of it is without assessing it properly. Even if it's a fundamental human right, if we can say that the benefits do outweigh the costs in this context, it might help to convince people who will be of that same opinion.
And I think your work is really about how do you keep improving measurements, right? Improving measurements to make a stronger case, which is I think really well done. Anybody else has any questions? If not, we might use this opportunity then to thank Lee.